everyone. Yeah, I just wanted to do a video today, just because I received my letter recently from the psychiatrist since that discharge, which I wasn't happy with. If you watch my other videos where I explained, if you've seen them, you will understand the process, what happened. I talked about that all in my previous videos. And I have actually complained. I sent a complaint to PALS, that's Patient Advice Liaison Service, which is the complaints service in the UK for NHS complaints. PALS for short, or that's the acronym PALS. So I sent them an email. I've also emailed the GMC, I just thought I'd cover all bases, the General Medical Council that is. PALS, Patients Advice Liaison Service, they got in contact with me to acknowledge the receipt of the letter, and they said that they will be in contact in July. Can't remember the exact date, but around sort of July time, but they said there could be a bit of a wait because they've been inundated. I wonder why. Lots of people complaining at the moment. Services are crap, that's probably why. Austerity and all that. Lots of things to complain about, people not getting the care they need. Yeah, I was also put in contact with a free advocacy service as well. We've also been in contact, so we'll see what happens with the PALS complaint. Fingers crossed. I'm not very hopeful, but you know, you have to hope a bit, otherwise you're left with nothing. But I guess I'm a bit of a cynic and a realist, and I've been through this so many times now, I kind of despair of ever getting anywhere. But yeah, we'll see what happens. I'm determined not to give up though. I'll keep bashing and bashing and bashing, because quite frankly what happened was absolutely disgusting. If you watch my previous videos, I know one of you commented that she'd never seen me as angry as that before. That's because I did a video immediately after that horrible psychiatric appointment, so I was kind of in a bit of a stew, shall we say. Yeah, and I just had to rant to get it off my system. So that's why I came across as angry, I guess, because I was angry. But yeah, so I just wanted to read out, obviously keeping it all confidential. Obviously I'm not going to name any names or anything, obviously, because this is confidential. I would like to read out the letter anyway. Yeah, the letter I got from the psychiatrist, because there's some things in it that I'm not happy with, which is the case pretty much for every single letter I get from psychiatry or any other service, really. So it says, ICD-10 diagnoses, autism spectrum disorder, obsessive compulsive disorder, recent diagnosis of ADHD, medications, none. My recommendation is for a trial of an SSRI antidepressant, as is well evidenced in the treatment of her condition, OCD. She is declining this. By the way, that was one of the main areas of complaint, was the fact she was effectively putting me under an ultimatum, saying I have to take these medications in order to get therapy, which for me is quite frankly disgusting, because medication, yes, medication has been evidenced as an effective treatment for OCD, but it's not the only treatment, and it certainly shouldn't be prescribed without therapy, like on its own. That's not good practice. And also, not everyone can take medication. I've got my own reasons for not wanting to take it, and they should be respected, and I shouldn't be basically told that I'm not going to get any help unless I take medication. That is disgusting. That's the main my main complaint, really. There are other aspects to my complaint as well. That's the main aspect. Care, investigations and unrequested. Care plan. As Anna does not wish to follow my recommendations and the risks are low. Risks are low? Are they really low? According to who? I don't think they're low. The risks are low. They're not low, man. Like, it really annoys me how these psychiatrists can assess someone's risk as low, and they haven't even asked a person what they think their risk is, because I wouldn't say my risk is low. I guess because I'm not suicidal, because I'm lucky I don't have depression, I'd be spared that one. That seems to be quite unusual, because most people with very severe OCD do tend to also have depression. I guess probably because, if your life is extremely limited, it's quite depressing. But I think in order to have depression, you have to have like a genetic predisposition, obviously. Like, you don't, it's like with any condition, some people are just more vulnerable to depression, and I guess probably the genes that predispose you to OCD may also overlap with depression genes, maybe, and that might be why there's such a high overlap between OCD and depression. So obviously OCD is quite depressing to live with, obviously. So you're being put in a kind of not a very nice situation, which could be depressing because you can't, maybe pursue the things you want to do. It's ego dystonic. You might have goals that you can't access. That's quite demoralising and can make someone depressed. But I would say only if the person's also genetically predisposed to depression. And I suspect that they're probably, like I say, are the genes that put someone at risk for OCD often, but not always, interact with depression genes. Obviously, there isn't just one gene for depression. These are risk genes. They're not genes that give you depression or give you OCD. They just increase your vulnerability. And I think I must be lucky, clearly, because I probably haven't inherited depression risk genes, because I've never been depressed, despite a condition that is very trying to live with. But I'm just lucky, I've never been depressed. So I count my blessings there. So I'm not suicidal. Don't self-harm. Things like that. So that's probably why he said I'm low risk. But there's more to risk than just being suicidal, depressed, or self-harm. And I feel that is not correct. I feel that I am at risk, actually, for other reasons. So I fundamentally disagree with that. And I forgot to actually put that in my complaint email, but when Pal's get in contact again, I think I'm going to raise that as well, because I'm not happy with that. I find that's very trivialising and kind of, in a sense, his opinion, and it's only an opinion, and it's not correct. Because I'm the one who lives with this condition, and I'm telling you, it is full of risk. So, and also, he only spoke to me for like about, I don't know, it's a very brief conversation. Never met this guy before. How can he judge in that short space of time what my risk levels are? Particularly as my elderly father is doing all my caring. And when he's no longer here, and anything could happen because he's getting on in life, I'm going to be at extreme risk very quickly. So the fact is I am at risk. Even if I'm not at imminent risk right now, although I would say I am still at risk, because the longer I'm being housebound, the worse my problems are getting, which is a bloody risk. And also, yeah, it is a risk. Being housebound is a risk for all sorts of things. So that is a load of absolute bloody crap. So, as the risks are low, what a joke, I am discharging her to your care. So that's back to the GP. He did say, and I am at least glad that he did this, to do him credit, all in all, it was a very bad appointment, but to do him credit, he does say, I would be grateful if you would consider offering her twice-a-year vaccination to be delivered to her and done in her garden, as I gather this helps her OCD. So, at least he did that. I don't know if this is going to do anything, though. He said himself, obviously you can't guarantee that they're going to do it. Give me it back twice a year, but we can but hope, but yeah, hopefully. I don't even know if GPs read these letters. They've got so many patients to see. I'm not even sure they really read these letters. I think they probably just skim it really quickly or something, or maybe my guess is their admin staff do it. So I don't think they actually read these letters. I could be wrong, but I don't think they do. I can't imagine they just sit there and read these letters. So I don't know. I would like her to be prioritised for support workers from obviously, I'm not saying the organisation to keep this confidential, but I was getting support prior to the pandemic from an autism organisation, although I forgot to tell him that I'm actually no longer receiving support from them because they've effectively dumped me off. Yet another organisation that doesn't want to have anything to do with me because I'm too complex for them. So it's not going to come from that organisation, they're going to have to look elsewhere. So that's a little bit inaccurate, but that's not his fault. I didn't really explain it to him, I don't think. Or I might have accidentally, I didn't explain it to him, but I'm no longer getting support from that organisation anyway. I gather she is on a social services waiting list for review. I will send a letter to them separately. Well, that's good, at least he's doing that. Okay, I'm going to move over to video number 2 now to carry on reading out the letter, so moving over to video number 2.